Talk to members of the medical community. Today, Dr. Shawn Hocker talking about osteoarthritis and how it affects, I guess, the knee in particular.
Yes. So osteoarthritis, in a layman's perspective, is kind of your wear and tear, aging process to the joint. And of all the joints that we treat osteoarthritis, knees are the most prevalent.
When you hear arthritis, you immediately think of the older sets of folks. Is this something that specifically targets people after a certain age?
Yeah, well, I would say that if we all live long enough and are active enough, we all get arthritis, and sometimes that's a blessing. There are different types of arthritis, inflammatory arthritis that can affect the younger. But in general, it's something that you just see from an attritional wear and tear. So most of the things that we see are degenerative processes, not necessarily one single heroic injury or event.
At what point, if you're at home, like a pain in an elbow or a knee, you might put an ointment on it, take an ibuprofen or something like that. At what point do you realize this is something a little bit more than what I think I've got?
The rule of twos. So if you are having symptoms and are struggling, 2 ibuprofen twice a day for 2 weeks, and if you don't see an activity modification in those 2 weeks, and if you're still having significant symptoms that don't allow you to get back to your normal activity, then it may warrant coming in and take a look at. Understand as we get older, aches and pains are part of the game.
Part of the day, yeah.
And so, if it responds and recovers with a few days of TLC, then that's probably not something that needs to be come in to be looked at. But if you're continuing to have symptoms despite that, then that's something to look at.
And the good thing for folks living in our area is the hospital, New Hanover Regional Medical Center, excellent when it comes to things like this. Knee replacement or knee surgeries, I was shocked to see the recovery rate. You're talking maybe a day, 2 days in the hospital before they're back out.
Yeah, so first of all, for my trade as an orthopedic surgeon, to come to a community that has a dedicated orthopedic-only hospital is really a blessing. And there's a lot of things from an efficiency and outcomes that you can gain from a facility that does one thing. And so at Cape Fear New Hanover Hospital, that's what we do. We do orthopedics, and we do it, live it, breathe it, and because of it, our outcomes reflect that. So, when you look at the evolution of knee replacement, I get asked all the time by my patients, what's the latest, greatest? And from the marketing bombardment that patients get, they hear it from the manufacturers. So they think this new implant or that implant is the latest, greatest. But I would say that the biggest boom that we've experienced in the last 5 years is actually the perioperative experience for the patient. Being able to manage their pain, accelerate their recovery, and transition to home comfortably in a rapid process has probably been the biggest change for all of us. The implants are continuing to improve, the quality of the materials improve, but as I tell patients who have successful outcomes with knees, thank your surgeon. The most important variable is not what you put in, is how you put it in.
How it's done. And you guys, you do it, I think it was 90% where you're getting favoritive remarks after the surgeries, and it just still...
I think we just reached our 12th year in a row where we've reached the 5-star health grade. So it's been something that we're very proud of, and it's something you can't rest on. Because it takes yearly energy to make these milestones and scores to maintain that outcome.
And we always tell people, if you have questions, don't email me, just go straight to the doctor themselves. Doctor, I appreciate the time.
Thank you, Bob.
Thank you. We'll be back with more.